Good afternoon. You can hear me? Good afternoon. Nice to be here and thanks for the invitation. Today I'm going to talk about the application of antimicrobial guideline, practical guideline. Very simply, we're going to talk about the need for antimicrobial guideline and the sources for them and the application, implementation, and then the auditing. There are so many slides, but I'm going to talk about them. I'm going to go over them very quickly. So these are the objectives, and then there is a need for antimicrobial guideline because there is increase in the resistance, and it will decrease the cost and improve the patient outcome. And there is so many issues in the antimicrobial resistance for all the diseases worldwide. That's why we have to utilize the antibiotics and antimicrobials in general, because it has to lead to stability and also effective programs. So the practical guideline produced by association, or some of them governmental, non-governmental, and some of them international organization. These are some of the examples from Western country, North America, and other area. Just it is here as a resource. And we will produce guidelines, and we look and try to find what is suitable for us. This is one of the famous guidelines, British Association for Antimicrobial and other guidelines. I'm going over some of them and showing you some of these guidelines. So, Center for Disease Control and Prevention, and finally the most famous one is Infectious Disease Society of America, and they have so many guidelines for almost all infectious diseases syndromes. So here by year and different syndromes. So here is very important. Before we use the guideline, we have to look for the evidence of creating this guideline. And as you know, that there is a systemic review, and there is other which has low impact, like case reports. But you have to be careful before selecting the guideline to look what is the evidence they have. And this is the grade where they look to the degree of the evidence, if it is strong or weak, and also they look for if there is any bias and what is the strength of the recommendation. So here the recommendation. So there is two major things. One is the evidence, how strong it is, and the second is the recommendation. So these, before we revise any guideline, we have to look and make sure for each thing we adopt from this guideline to look for the evidence. So, it is very important for us to select the guideline, and based on what? All the guideline has to be patient-centered, first of all. Second, there is a tool where we can use to select the most suitable guideline, and actually there is a recommendation how to do grading for the guideline and select the best of them. And there is two of them where you can use them and select what is the best and has a higher grade than the other. So Agree To is the tool that we use to select the most updated, the most valid guideline. And these are some of the scoring that can be used, and these are the guidelines. Many of the institutions, instead of developing the guidelines, they adapt the guideline. And in order to adapt the guideline, adoption or adaptation, either you go over so many guidelines, you reject some of them, and you can adapt or adopt one of these guidelines that you need. So here the process of adaptation, where you form the committee to set the guideline, do the grading, and see the need, the strategy, and you see what requirement, and then you disseminate it, and then you do education about it, and implementation, and then you audit and study the effect of the implementation of the guideline. As you know, because each hospital different than the other, each institution institution, they have different antibiograms, so you have to use and modify according to the data that you have. Selection of the topic of the guidelines for antimicrobial depends on institution. Some of the guidelines are priority for the one institution more than the other. You have to select the one that you need. So these, and then the final step, as I said, it is dissemination and see the tool, how you can spread the guideline. The core component, there is so many core component is clinical guidance for prophylaxis or management, regulation of antimicrobial, education, infection control, and other healthcare sectors. These are the stakeholders. The people are involved in the guideline. You have to involve them from the beginning, from the process of adoption of the guideline, and discuss with them and see their concern in order to make it easy for implementation. Then after you have the guideline, you send it to Antimicrobial Utilization Committee. It is one committee in the hospital, has microbiologists, infectious disease, pharmacists, and other stakeholders where they can talk and see the guideline, the best way to implement it. And they do other things other than the guideline, like restriction of antibiotics and other functions. This is our committee. This is the scope of service. I'm not going to go over them, but they have members as well. And then the final step is the implementation. In order to implement the guideline is usually big and lots of pages, tables, so you have to make a symbol for the people in order to understand it by algorithm or a simple protocol, and then try to integrate it with the clinical practice and disseminate it and use other tools like mobile application or other posters or others. And then after you implement, you need to make sure that it has impact, it is implemented in the proper way, so you have to do audit and revising and collect data, analyze it, and make sure that there is an outcome. And sometimes you can measure the outcome, and sometimes you cannot measure it. So these are some of the ways that you can use tools you can use to make sure about the implementation of the guideline. There is two very important publications. One of them from IDSA, and the second one from European Association. Both of them talk about antimicrobial stewardship. Those are very updated, has lots of information, and I'm not going to go over them because just repetition, but they talk about the function, the people involved, and how you measure the outcome for the implementation of the guideline. If anybody had chance, it is good to go over them. So auditing of the guideline, it just you go and collect the data, and then after that you analyze the data, and you see if you met the requirement or not. And then auditing can be done through the electronic, through the application, and you collect the data, and this is very helpful and easy, and you have your own KPI. And then people who can facilitate individuals, organization, and environment, and this is very important in case of failure. If you have failure, or if you didn't meet the requirement, you have to go back and talk to those people and meet with them and see what is the problem. Either it is auditing itself, or the process of selection of the guideline, or awareness of the people, and you have to look for other tools to make sure that it is implemented in that. And then after that, you go to each one of these factors and study it carefully and try to troubleshoot if you could make it better for implementation.